My professional development presentation is on eating disorders and school-based prevention. Eating disorders can be really uncomfortable or difficult to talk about, but there's a topic that is so important for us to understand not only what they are, but the impact they can have on someone's emotional, physical, and mental health. A lot of people don't have a lot of knowledge on eating disorders, or maybe just have a very limited knowledge base. Maybe they only understand a little bit about what some of the types are just from hearing them in the media. But this presentation is geared towards informing you on what eating disorders are, some of the common social, physical, cognitive effects, and we're focusing specifically on adolescent population, so school-age children. And this presentation is also going to talk about the integral role we as school counselors and school staff and other professionals can have on early detection and prevention. First thing we're going to talk about is what eating disorders actually are. They're more than just going on a diet to lose weight or trying to make sure you exercise every day. They are extreme eating and dieting behaviors, like a diet that never ends and gradually gets more restrictive. So, eating disorders are defined as any range of psychological disorders characterized by abnormal or disturbed eating patterns or behaviors. They involve extreme emotions and attitudes and behaviors surrounding weight and food, and they have serious emotional and physical consequences and can be life-threatening. It's not necessary to get into too much detail about each different eating disorder, so I'm just going to give you a quick snapshot of the types of eating disorders that we should be aware of. So the first one is anorexia nervosa, which I'm sure we all have heard of, and that's characterized by an extreme fear of weight gain, a very restricted food intake, and the person has an extremely low body weight. Bulimia nervosa is binge eating, which is eating a large amount of food in a small amount of time, followed by inappropriate methods of compensation, and this can mean the self-induced vomiting after eating, or the use of laxatives or diuretics, or even excessive exercise. The next eating disorder is binge eating disorder, and this is similar to bulimia, except there is no inappropriate method of compensation after binge eating. And the next eating disorder is other specified feeding or eating disorder, and that's kind of a combination of symptoms from each of the above eating disorders, and we'll get into that a little bit more on the next slide. I wanted to go over this eating disorder in a little more detail because it is what helps us understand why it's so important for us to be able to recognize warning signs of eating disorders in school. This is actually the most commonly diagnosed eating disorder, but the hardest to detect. The reason for that is because people fall into this category if they have symptoms of eating disorders that cause them distress, but they do not meet the full criteria. So for example, somebody could be severely restricting their food intake, but not be underweight, so they can completely fly under the radar and go undetected, even though their body is suffering the consequences of anorexia. So now that you understand a little bit about what each eating disorder is characterized by, this is a really important statistic to keep in mind as the presentation continues. So according to the National Eating Disorders Association, researchers studied a group of 496 adolescent girls, and out of those, 5.2% of them already met the criteria for anorexia, bulimia, or binge eating disorder, and when they factored in OSFED, the number jumped to 13.2%. Talk about why eating disorders might be more likely to occur in adolescence. Actually, eating disorders are more likely to develop between the ages of 13 and 17 years old. That's because this marks a time of a lot of emotional and physical changes. This is when puberty is happening, bodies are changing, and girls especially might be becoming uncomfortable with all the different changes that are happening. This is also a time of greater independence during the teen years. Teenagers might be feeling that they're not in control of their personal freedoms. Academic pressures, this marks a transition between middle and high school. Academics are getting tougher, feeling a lot of competitiveness and pressure. Also, this is a time where the desire for peer acceptance really escalates. So now we're going to go over some of the physical, psychological, and social signs of eating disorders. Since we're talking about the adolescent population or the school-age population, I just wanted to highlight some different signs and symptoms that might be able to be noticed in school. Obviously, with eating disorders, there are a long list of physical signs, but I just wanted to pay attention to a couple of the more common ones and maybe ones that are more likely to be able to notice in a school setting. So school staff can notice a change in a student's weight. The student could be wearing oversized clothing or a constant touching of one's body, like their arms or stomach, to check their size. If a student is at an age where they should be going through puberty, staff could notice that a student is not gaining height relative to other students students in the same grade. For example, a student with bulimia could have teeth discoloration or scarring on the back of their hands from inducing vomiting, as well as maybe make frequent trips to the bathroom after lunch. School staff members see the same students for 10 months out of the year, which give them the ability to notice how students are physically changing, granted they know what to look for. Being aware of the physical signs of eating disorders in adolescents can aid in early detection by teachers, therefore speeding up intervention. Students with eating disorders can also exhibit psychological warning signs in school. Perfectionism, which is characterized by competitiveness with other students, over-responsibility, and emotional distress over academics are characteristics of eating disorders that can be evident in a classroom. It's important for a teacher to not mistake excessive perfectionism for a positive attribute. A student can also be constantly criticizing themselves and have an obvious low self-esteem. Feelings of helplessness, anxiety, anger, and depression are also psychological warning signs. The problem is that the longer an eating disorder goes undetected, the more the lack of nutrition will take a toll on the student's brain, increase the severity of psychological effects, and decrease cognitive functioning. Students with eating disorders could become socially withdrawn and isolated from their peers. School staff could notice that a student who once had friends now keeps to themselves, sits alone at lunch, and does not make an effort to interact with peers. Due to preoccupation with eating disorder behaviors such as excessive exercise, specific dieting schedules, and the need to hide any compulsive behaviors, a student may begin to avoid social and recreational activities such as after-school clubs or sports. School staff, such as coaches in this case, should intervene if they notice any of these behaviors. Eating disorders can affect a student's ability to learn, whether it is because of poor nutrition or due to another coexisting disorder brought on by the eating disorder, such as anxiety, obsessive-compulsive disorder, or depression. Some effects directly related to a student's ability to function in school are the following. So, active dieting can reduce the ability to concentrate, focus, listen, and process information. Nutrient deficiency of iron can have an immediate effect on memory and ability to concentrate. Also, a student can have increase in absenteeism. This could be due to impairments from the eating disorder or having a weaker immune system or because the student is just not comfortable coming to school due to any reason related to their eating disorder. I think one of the most important points to remember when it comes to eating disorders is the fact that they come in all different shapes and sizes. As school counselors, teachers, and other school staff, we really need to understand that you can't diagnose an eating disorder just by looking at someone. There's so much more than just physical symptoms. Although most people with eating disorders are portrayed by the media as being emaciated or really underweight, that does not represent the vast majority of eating disorder sufferers, most of whom are not underweight. So these are the perceptions that can allow eating disorders to remain untreated, and this is what causes distress in eating disorder sufferers, making them feel that they're not sick enough to deserve treatment. So that's why it's really important for us as school staff to really understand what to look for, not just based on physical symptoms, so we can help in early detection. So what are some of the highlighted problems that we need to address in schools? So the challenge in detecting eating disorders that might be flying under the radar, such as OSFED as we discussed earlier. Also, knowledge of warning signs and eating disorder behavior and effects of them beyond the physical. Also, guidelines on how to appropriately assist a student who may be struggling with an eating disorder, and a lack of variety of school-wide interventions. Teachers get the chance to develop meaningful relationships with their students in class so they can play a really integral role in early detection if they are equipped with the appropriate knowledge. So school counselors should run or assist in organizing in-services or workshops for teachers and school staff that do things such as provide education on what eating disorders are and the signs and symptoms of them, and also provide skills on how to communicate with a student who they think might be struggling with an eating disorder or if a student discloses one to them, and also how to incorporate positive self-esteem, confidence, and a positive body image into their lessons. Another suggestion for school counselors would be to meet with small groups of maybe at-risk students and administer the Adapted Eating Attitudes Test, which is a questionnaire designed to determine which students have significant eating disordered attitudes. After scoring tests, the counselor could meet with the at-risk students to discuss their responses further. This is just a piece of the eating attitudes test that you could take a look at. Schools should establish having a school-based resource person. This person would be a staff member at the school who is knowledgeable on eating disorders and knows how to effectively confront an at-risk student. Maybe they have communication skills to work with the family and support further interventions. That's what's great about working at a school. There's a lot of different staff members that maybe had unique backgrounds, and maybe there's someone at the school who's had experience working with eating disorders. These are some guidelines that you should keep in mind when it comes to assisting a student. If a student discloses a personal problem to you, such as an eating disorder, you should do the following. Consider the setting. For example, if a student discloses a personal problem to you during a class or another setting where others are present, practice protective interrupting, like tell them thank you for sharing that, you'd really like to follow up with them after class. Also, be aware that the student has divulged a very personal concern and has chosen you to express it to. So acknowledge to them how difficult it must be for them disclosing personal concerns. Next, you should ask the student with the eating disorder privately how they would like teachers and others to respond when asked about how the student is doing. The next thing to keep in mind is contacting the student's parents and guardians to assure appropriate medical and psychological follow-up. You also need to keep in mind that the problem could be more serious than what the student is disclosing to you. When dealing with a student with an eating disorder in school, it's totally understandable to be fully invested in their concerns and their recovery, but as school counselors, it's important to consider the importance of assisting friends of students with an eating disorder, so these are just some guidelines to keep in mind. When working with friends of students with an eating disorder, it's important to protect confidentiality and privacy by providing generic information about how to be supportive to a friend who is experiencing an eating disorder. Also, it's important to remind friends that they're not responsible for their friend's eating disorder or recovery. We also should encourage friends to continue usual activities with the person experiencing the eating disorder. Also, we need to consider the needs of the student's immediate friendship group because they could be feeling a loss in their friendship circle or confusion and not understand what's going on or how to relate to their friend. We also need to encourage friends to discuss concerns with you or another trusted adult. Eating disorders are a really big deal and can affect a lot of people, so it's important to encourage them to talk about their feelings. Probably the most important thing to realize when it comes to eating disorders in school is realizing their seriousness and understanding that a student who is struggling with one needs help beyond the school's capacity. As school counselors and school staff, we can help provide steps and resources for appropriate referral. So the first thing you want to remember is the importance of collaborating with colleagues to create specific guidelines on referrals for students suspected of having an eating disorder. You want to be prepared with the necessary steps to take when you are approached with this problem. Next, you want to be prepared with appropriate local counseling resources and medical practitioners who are familiar with eating disorders, and also it would be important to be prepared with options for students who may have limited or no insurance coverage. These are some other interventions that can be implemented on the school level. So we can update school anti-harassment and anti-discrimination policies to ensure they include provisions about physical appearance and body shape. We can eliminate student weighing and BMI measurements in health and PE and other classes. And if we can't do that, make it a policy not to weigh students publicly or in close proximity to fellow students. Also, we can advocate for a wide range of tasty and nutritious foods in school cafeterias and vending machines and a variety of snacks and beverages. Also, consider offering community outreach programs on eating disorders. You can invite experts in the area to speak on the topic. It's also really important to review posters, books, other materials in school to ensure that they include a broad variety of body shapes, sizes, and ethnicities. So eating disorders are a topic that's really important to not be afraid to talk about, and hopefully you learn about how significant they are and how much they can really impact a student's life. So hopefully after this professional development, you're able to take the information that I presented to you and apply it to your school so you can play an integral role in early detection of eating disorders. Thank you.